So the purpose of the initiative Diabetes Can Break Your Heart is to increase the awareness of the link between diabetes and heart failure. Patients with diabetes are at a particularly higher risk for cardiovascular adverse events, higher risk for heart attack, higher risk for stroke, higher risk for peripheral vascular disease, and dialysis, kidney failure, and all of these things we've been worrying about for a very long time, and we try to lower the risk as much as possible. Having said that, the risk for heart failure, if anything, may be a little bit stronger or at least equal. So there is clearly a risk for heart failure. But the bigger issue is that once these patients develop heart failure, they have really bad outcome. The combination of heart failure and diabetes is really a bad combination. However, unlike the risk for heart attack, we don't necessarily think about the risk for heart failure as such. So the reason for this initiative is to bring a broader awareness for the risk of developing heart failure. What are the things to look out for? What can we do about it? And have sort of the public and patients with diabetes and the communities be a little bit more engaged about this issue. If you look at overall why patients develop with heart failure, just in general, the two biggest risk factors are coronary artery disease and hypertension, and both of them are more common in patients with diabetes. So patients with diabetes are at a high risk of developing hypertension and high risk of developing coronary artery disease and myocardial infarction. So that is one pathway through which they can develop heart failure. There are other issues also. So for example, chronic kidney disease is a major complication of patients with diabetes, and chronic kidney disease certainly is linked to heart failure as well. But we are also fascinated by these alternate mechanisms whereby the metabolic changes in the heart by itself that you see in patients with diabetes can cause something that we call diabetic cardiomyopathy. And then finally, there is this systemic effect of obesity, cardiometabolic sort of state related to inflammation and oxidative stress, sort of the milieu in which a patient with diabetes lives in, and that also puts the patients at high risk for heart failure. So it's really not one particular pathway, but there are multiple ways by which people can develop heart failure, and that's why they are at high risk. The problem is that although there are multiple pathways, they are not distinct. So most patients with diabetes actually have more than one of these abnormalities at the same time that really escalates the risk of developing heart failure.